Welcome Gold delegates from around the world. I'm Fleur Bickford, Program Director and MC for Gold Conferences International. And I'm here today talking with one of our Gold Lactation speakers, Cynthia Mojab, and we are talking about her upcoming presentation, Brief Breastfeeding Encounters, Effective Counseling Techniques When Time is Limited. So welcome, Cynthia, and thank you for being with us today.
Thank you so much for having me.
So I am really excited about your topic and really looking forward to it because I think it's a really important one. Before we hear a little more about your topic, though, I was wondering if you could just tell us a little bit more about yourself. I would love to hear more about how you came to combine counseling and lactation consulting.
Sure. Well, I became a mental health care provider before I became an IBCLC, and it was my experience with breastfeeding, in my own personal life that prompted me to ultimately pursue the IBCLC credential. And once I had, those two toolboxes in my collection of skills, it seemed pretty natural to combine them in the sense that you can't somehow forget, the other role while you're engaging in one role. And so basically, I ultimately found myself in a private practice where most of my clients are new parents. Many of them um, have had a hard time finding breastfeeding compatible mental health care. And they find their way to me and are very relieved that yes, there actually are treatment options for mental health challenges that don't require you to immediately wean, and that was pretty much what they were being told by other healthcare providers. So it's kind of a, part of my work is kind of a niche situation where, because I've got the two skill sets, I'm able to combine them and put one hat on and take the other one off, or switch back and forth between them in one session in working with breastfeeding families who are coping with perinatal mental health challenges.
That's wonderful. I think it's so important that we have professionals like yourself who can address those mental health issues in a way that is compatible with breastfeeding because, as you mentioned, so many of the moms are told, well, just stop breastfeeding. You can't breastfeed because you need to be taking this medication. And so often it's not true. So it's, or there's other options. So I
Right.
love that you're able to combine those two um, professions. It's just fantastic. So next question I have for you is just hoping you can tell us a little bit more about your presentation. I know you're going to be giving us some information about counseling techniques when time is limited, which like I said, I'm really looking forward to it because I think a lot of us, when we're working with moms, although I work in private practice and I have the luxury of sitting down with a mom for a couple of hours, but a lot of times, people don't have that. You're in a situation where you've got 15, 20 minutes with a mom and there's so much that you want to try and do in that short space of time. So um, just want to hear a little more from you about why you think this topic is important and what you're going to be talking about during the presentation.
Sure. Well, you really nailed it right on the head there. A lot of care providers who are supporting breastfeeding families, they work in systems that they don't have really control over that structure, and the fact that their opportunities to be with new families are so time limited. And so since this kind of structure is really pervasive for many breastfeeding specialists, um, having tools in your toolbox that are specifically designed for these kinds of circumstances can increase your effectiveness. And, even when you work in private practice and have, relatively speaking, much longer times with, new families, um, that still may not be everything that they need. Some situations are really complex and can take a lot of time to resolve. Many families don't have the resources to have as many private consultations, with an IBCLC, for example, as they really need, just because they're constrained in terms of their resources, their insurance, their family funding. So whether you're working in, a hospital setting or in private practice, oftentimes the situation somehow relates to you wish you had more time with that client. The client needs more time with you. So these kinds of tools are helpful in extending your impact beyond the conclusion of your time with that family. So it's kind of a way of maximizing your impact and trying to help it continue even after you're gone. Your official time has ended. You've left them with ways of thinking about their situation and their own tools, new tools, additional tools, tools that they had before but they didn't think about using, things that can help them continue working on solving problems after.
I love that idea of, for us as breastfeeding professionals to be able to do that and be able to extend our impact, as you put it. So important, I find, just to be able to, I know in my own practice, I'm trying really hard to find those ways to empower parents so that when I leave, they can carry on. You often hear from moms who, they you get the response from them of, well, this only works when I'm with you.
Right.
And I always, in my own practice, my goal is to have them be able to make it work when I'm not there, because I can't be there. So I love the idea of, finding tools that enable us to do that a little better. So really, really excited to learn more. So what are you hoping that delegates will be able to take away from your presentation? What do you hope that the delegates will come away with and be able to really apply in their own practice?
Well, a lot of us have, in one way or another, learned, what might be considered basic counseling skills. The reflective listening, and facilitating informed decision making, and these are really important skills. And at the same time, they aren't the only skills that are helpful. So I really hope that participants will walk away feeling like they have added some tools to their toolbox that they feel are useful and are something, as you said earlier, that helps empower new families to continue with positive change beyond the conclusion of the encounter. This is really a kind of a competency focused approach, an approach that sees parents as having resources and skills and knowledge and wisdom that can be applied to the challenges that they're facing. So I'm hoping that attendees will really walk away feeling like they've got some new tools that they can use in real life, breastfeeding families to continue with what got started during that brief breastfeeding encounter.
Okay, thank you so much, Cynthia. I love the idea of what you just said about families having knowledge and wisdom, and it's so true. Mothers have those instincts, and they do have that knowledge and wisdom. Sometimes they just need, our help to really sort of tap into it and be confident about their own instincts. So I really love that. Really looking forward to hearing more during your presentation. So thank you so much for joining us today.
You're welcome. I'm delighted to be part of Gold again this year.
And we are so delighted to have you. So for our delegates who are listening, you can hear more from Cynthia during her live presentation on Monday, April 27th at 2100 UTC. So we look forward to seeing you then.